Thank you for joining us on our virtual prenatal tour of the Regina General Hospital. The Regina General Hospital is located at 1440 14th Avenue. The main entrance can be accessed from 14th Avenue or Toronto Street. Main registration is open from 6 a.m. to 6 p.m. Monday to Friday, except on statutory holidays. 15th Avenue registration is open from 7 a.m. to 3:30 p.m. Emergency registration is open 7 days a week, 24 hours a day. The emergency entrance is located to the east of the main entrance. If you go to the hospital between the hours of 6 p.m. and 7 a.m., you will use this entrance. And of course, this entrance is always available anytime you are having a health emergency. There is emergency parking close to this entrance, but if you are not experiencing an emergency, please try to park in the paid visitor parking or street parking. It is important to bring your provincial health card as well as any papers that your healthcare provider has given you throughout your pregnancy to the hospital. Please feel free to bring anything from home that might bring you comfort during your stay. A reminder that the hospital is a scent-free environment and no open flames like candles are allowed in the building. To get to labor and delivery, take elevators 7, 8, and 9. Stairs are also available. Go up to the second floor. Turn left off the elevators and then follow the hallway. You will turn right, then labor and birth is the first unit on your left. The doors to labor and birth are locked. To gain entry into labor and birth, enter the family waiting room to the left of the main doors. Then pick up the phone. You don't need to dial a number. A staff member from labor and birth will answer the phone. Then they will open the doors to the unit. Usually, you will be directed to the assessment or triage area. Here, a registered nurse will quickly ask what brings you to the hospital and direct you to either a special assessment room or the in-unit waiting room. In this area, one support person is invited to be with you. Each triage room is private. Once you are in one of these rooms, a registered nurse and members of the medical team will ask you more questions about what brings you to the hospital, as well as important questions about your pregnancy. Here they will ask to see your prenatal papers from your doctor or midwife. In this room, the staff can check your contractions, see if your water has broken, or assess any other concerns you have about your health or your baby's health. If you are having an induction of labor, the process may start in this room. Your baby can even be born in these rooms. Once you're admitted to the labor and birth unit, you will be moved to a labor room with your nurse. Each room on labor and birth is private. You will labor and birth your baby right in this room. These rooms have everything you and your healthcare team will need to help you throughout your experience of labor and birth. There are small bar fridges in each room. Patients and supports may bring in their own food and drink. There are also some drinks and snacks provided for mom in the galley kitchen. Please ask your nurse if you may eat and drink while in labor. You will stay in your room following the birth of your newborn for about 2 hours. At this time, visitors are permitted to come see you and your baby. Siblings of the baby are welcome, but must be accompanied by an adult. Labor and birth has 2 operating rooms, but please know if you go into these rooms for a cesarean section, staff coming in with you are highly trained and very skilled at keeping you and your baby safe. Since this is a sterile area, please follow the staff's direction about where to sit or stand. Please do not touch anything that has a blue drape covering it. To the left, you will see some machines that help the healthcare team to do your surgery safely. Once you are inside the operating room, you'll be asked to step up on the bed using the stool provided. If you've already been in labor, you may be moved by bed into the operating room and you can simply slide over to the operating room bed. You will meet extra nurses and the anesthesia doctor who will be there to keep your pain managed throughout the cesarean section. There is only one support person allowed in the operating room and recovery. Once the surgery is complete, you'll be moved to the recovery area. Sometimes babies need a little extra help and care, and if that's the case, they may be admitted to the neonatal intensive care unit, which is also called the NICU. The NICU is located in the same hallway as labor and birth. From labor and birth, turn left and walk down that hallway. The NICU will be on your left-hand side and you will see these doors. If your baby needs to stay here, you are welcome to be with them almost all the time. The staff will teach you how to wash your hands very well, and they will talk to you about their visiting policy. Welcome to the mother-baby unit. After the delivery of your newborn, you will be transported to the mother-baby unit. Your assigned nurses will greet you in your room on transfer. Your nurses will complete assessments on you and your newborn and provide you with education on how to care for yourself and your infant. Our goal is family-centered care, which means keeping you and your baby together. You will be able to have family and friends visit you at this time. Siblings are welcome to visit during daytime hours, but must always remain accompanied with another support person. During the night, your support person will be able to stay to provide assistance and support to you and your newborn. Children and siblings are not able to stay the night on the mother-baby unit. Your room on the mother-baby unit has a bed with call bells. You can call your nurse for anything you may need or for any questions that you may have during your stay. You will have closets to store your belongings, a fridge for food and snacks, and a pull-out sleep chair where your support person can sleep. Your room has your own washroom equipped with a tub shower and an emergency call bell. You can request an early discharge by talking to your doctor or midwife. Most families will stay for approximately 24 to 48 hours. However, sometimes your stay will be longer depending on the needs of you and your newborn. Your healthcare team will keep you informed of the plan of care, plan for discharge, and expected length of stay. On admission to the mother-baby unit, your nurses will orientate you to the unit and provide information on unit policies, including safe sleep practices and falls prevention. You'll be given education booklets on how to care for yourself and your newborn, as well as teaching sheets to help assist in educating you, your support person, and your family throughout your stay. The nursing team will provide information on how to care for yourself and your newborn while in hospital and after discharge. The nurses will supply you with pain medication when needed. If you have pain, it's good to talk with your nurse so they can assist in managing your pain when you're at the hospital. The staff will discuss your feeding plan and will be available to provide assistance with breastfeeding when needed. Every day at 10 a.m., there is a breastfeeding class that you can attend and meet with one of our lactation consultants. Breastfeeding education will be distributed and you will have the opportunity to ask questions. The lactation consultant is available for consults if you're having difficulty feeding your newborn. Your nurse will be happy to arrange a consult if needed. Your nurses will communicate with your physician throughout your stay. You and your baby will have blood work done approximately 24 hours after delivery, and your nurses or physician will communicate the results with you. Depending on the lab results, your physician may order medications, phototherapy, or other tests as required. The maternal and child team has social workers that can be accessed on labor and birth, mother-baby unit, and the NICU. Referrals to the social worker are made by your healthcare team. Referrals to social work are made to ensure that you have all the support you need prior to being discharged home. Social workers approach all patients and families in a trauma-informed manner with a solution-focused approach. First Nations and Métis Health Services are available to assist with patient advocacy to ensure your preferences are integrated into your care plans, assist with any status registration, and facilitate referrals to cultural support workers, as well as connect you and your family with community-based supports and resources. Our unit clerks on Mother Baby Unit will be available to see you and your newborn during your stay. They will go over birth certificate paperwork, birth registration, and social insurance number paperwork with you so that you can complete them prior to your discharge. Hearing screeners will come around to test your newborn's hearing prior to your discharge. If required, SHA has interpreter translation services 24 hours a day. Your nurses can connect with the interpreters over the phone to assist in providing education and support to you during your stay. Prior to discharge, your nurses will provide or assist with your newborn's first bath and provide education on cord cleaning, newborn blood work, output, and what to watch for when discharged. They will also complete assessments and any required procedures. When being discharged, your nurse will provide you with instructions on how to care for yourself and your newborn and review any documents that will need to be signed prior to leaving our unit. This is to ensure that all needed education has been provided to you and so you feel safe to go home. They will also discuss when you and baby will need to follow up with your physician when discharged. Your nurses will also review how to secure your child in the car seat safely. You can bring your baby's car seat at any time during your stay on the Mother Baby Unit. Your nurse will also provide you with resources of who you can contact when you're at home if you have any questions or concerns with yourself and your baby. The Maternity Visiting Program or public health nurse will follow up with you in the community when discharged home. The Mother Baby Unit will provide you with information during your discharge teaching. Our goal is to provide you and your family with excellent family-centered care during your stay on the Mother Baby Unit. That's it for our tour today. We hope that you found this information useful. Thank you for trusting us with your care.